Cordero. I'm your student nurse for today. I'm here to demo or illustrate the catheterization. Catheterization, it is the prevention of COTI, means catheter-associated urinary tract infection. Clean the trolley with clean cloth, warm water, and detergent, like this one. From left to right away from you. After that, disinfect using alcohol wipes and allow it dry. Ensure that preparing equipments outside the patient's zone. These are clinical waste bag, this one, the catheter, 2 sterile gloves, these 2, sachet of single use of sterile normal saline, normal solution, this one, a syringe containing 10 ml of sterile water, a syringe containing a single-use sterile anesthetic lubricate, a hypoallergenic tape, this one, to secure the catheter, drainage bag, a sterile specimen container, and a disposable apron. A sterile pack containing a gallipot, this one, a cotton balls, the forceps, kidney tray, 2 sterile drapes, and 1 fenestrated. After that, place all the equipments or items in the lower shelf of the trolley. And go to the patient's zone. At this stage, ultrasound is being taken for the presence of urine and bladder on the knee for catheterization. Good afternoon, ma'am. I'm Nicole V. Cordero. I'm your student nurse for today. What is your name again, ma'am?
Rosalinda Cadena.
Good. How are you feeling today, ma'am?
Fine.
I'm here to catheterize you by maintaining your healthy urethral hiatus, or to ensure that you have no urinary tract infection, or to assess if you have that UTI. We have to maintain the patient's privacy because the private part of the patient is exposed. This is the most important thing to do. Attach the clinical bag and put on the apron. Open the outer cover of the sterile container and slide the content. I'm pinching only to the corner. I'm wrapping to create a sterile field. Open all items with non-touch technique. It is to maintain the sterile field. Perform hand hygiene using alcohol-based hand rub. After that, put on the gloves. Put the sterile normal saline from the single-use sachet into the gallipot. Use the sterile drapes under the buttocks of the patient. And the 2 fenestrated drapes over the genital area. ensure that your patient is comfortable. Are you comfortable with your position, ma'am?
Yes.
That's fine. Examine the genital area to identify where is the urethral meatus is. It is below clitoris and above the vaginal orifice. Spread the labia minora and labia majora. Clean the urethra with sterile normal saline and sterile bowls. Clean downwards, a single motion and left side. And also use another one to the right side. And also to the middle. For the urethral opening of or urethral meatus, use circular motion. Dispose gloves and do the hand hygiene. Put on a new sterile gloves because I perform a aseptic task. Use the gel to lubricate the tip of the catheter. It to the urethral meatus. Only touch the plastic catheter tubing. The vaginal touches the catheter, disregard it and use a new one. Once that it is inserted, the urine begins to flow. Continue to advance around 5 cm around urine to leak into the kidney. Using non-touch technique, inflate the balloon of the catheter with 10 ml of sterile water, following the manufacturer instruction. Remember, do not inflate it with air as the catheter will float into the bladder and cause leakage of urine. Gently pull the catheter back until the retention balloon touches the bladder wall. Connect it to the drainage bag using non-touch technique. Secure the catheter by taping it to interfile. Thank you for your cooperating, ma'am.
Welcome.
After all the procedures, document all necessary things to document. The equipment should be sterilized and the disposable one should be trashed. Before trashing, it is being segregated. Perform hand hygiene after all.